Olá, boa tarde. Eu sou a Isabela Salles, diretora do ABC Medical Academic Meeting. Bem-vindos às apresentações de trabalhos científicos. Antes de começar, gostaria de explicar como vai funcionar a presença. Vai ser um Google Forms que deve ser preenchido. O link está na descrição deste vídeo. Para completar o form, será necessário preencher com 2 palavras-chave. Essas 2 palavras estarão presentes ao longo das 2 apresentações nesse vídeo. Obrigada!
Can you see the presentation?
Yes.
So good afternoon, everyone. My name is Gabriel Barbosa Huszcz. I'm from the Faculdade Medicina de Mogi das Cruzes. And with my orientees, Dr. Lucy and Dr. Tatiana, we developed a research called The Impact of Disinformation on SARS-CoV-2 Pandemic that I will present to you today. So in the early December of 2019, a severe acute respiratory syndrome starts to take over the city of Wuhan in China. The disease was called coronavirus disease, COVID-19, and it's caused by a beta coronavirus family named SARS-CoV-2. The virus had a rapid spread and infected all continents, so-called a pandemic. Followed by this quick dissemination, a lot of fake news about the new disease starts to arise. Lots of information of the virus spreads across social medias and internet sites. In this scenario, in a conference of 15 February of 2020, Tedros Adhanom, the World Health Organization director, said, "We're not just fighting an epidemic, we're fighting an infodemic." So this word, infodemic, became a key word to outline the perils of misinformation phenomena during the management of the virus outbreaks. The infodemic gave rise to the lack of reliable information and make difficult the work of both government and professionals dealing with the pandemic. The image shows in the middle Tedros Adhanom and in the right Sylvie Bryant. Sylvie Bryant is the director of the infectious hazard management at the World Health Organization, and she says, "We know that every outbreak will be accompanied by a kind of tsunami of information, but also within the information, you always have misinformation and rumors. But the difference now with the social medias is that the phenomena is amplified, and it goes further and faster, like the viruses that travels with people and go further and faster. And with this kind of rapidly environment that the information can spread faster, especially fake news can strongly influence people's behavior and alter the effectiveness of the countermeasures deployed by the government. So, followed by the problem made by the fake news and the infodemic, we developed an opinion pool identifying common fake news, population beliefs, about the dissemination of the fake news during the pandemic. We also used two infodemiological studies in Italy and in China. The study received 200 responses from 5 Brazilian states: Bahia, Rio Grande do Sul, São Paulo, Paraná, and Santa Catarina. And the vast majority of the people who took part of the study had contact with fake news during the isolation period, 93% of them. And other 93% of them listed WhatsApp, the social media that they seen more fake news, followed by Facebook and Instagram, like in the graphic on the figure 2 that shows it. So, reaffirming Sylvie Bryant's speech about the infodemic, in the social medias, the phenomena of outspread goes further and faster. We can see 32% of the interviews claim to have belief or not being sure about fake news. That's more than 1/3 of the people that took part at the opinion poll. Furthermore, infodemiological studies that took part at Italy's saw a growing number on researches coronavirus-related terms, such as masks, coronavirus symptoms, and bulletins. Image 3 shows a Google Trend graphic that correlated the term coronavirus in blue to SARS-CoV in yellow and influenza in red. So this shows not only that population had contact with the fake news during the isolation, but also that the phenomena can cause increased misinformation and deficit in countermeasures proposed by professionals in the government. The large amount of information circulating on the web gives more and more strength to the infodemic, which can fade the fake news behind its network. In addition, social networks were a very common environment among the participants for the circulation of the fake news, especially the WhatsApp and the Facebook. As the news spread within the web, search and zap, the concern about the pandemic starts an infodemic. But giving rise not only to a health problem, but gives freedom to the fake news in its new form, the fake-demic. And this difficults the work of the health professionals and increase the panic in the population. This is the reference. Thank you very much.
Thank you, Gabriel. So we'll start the comments with Alessandra Goulart.
Yeah, thank you. First of all, it's a good presentation.
Thank you.
I like very much this idea to explore the fake news during the pandemic. I have just one question. I have more comments about the study as well, but here I have to choose to talk about only one issue about the study. So I'm curious to know about what kind of fake news were found in this study, because you mentioned that most people, they heard about fake news, a lot of fake news from the Facebook and WhatsApp, but I would like to know about the kind of fake news, because they consider it was very criminal, dangerous for them, and what the effect for the participants.
I don't have the space to include these fake news, but we have like medications, principally medications that don't have. Okay. Yeah, about medications. Some about the mask, the the useless of the mask,
Okay.
and I think it's this one are the more viewed, more talk about in the study, that the participants more cited.
Okay. Okay, thank you.
Thank you.
Andrea, please.
Hi, Gabriel. Congratulations. It was a great presentation. I was really clear. Congratulations. The slides were good. I just have a few comments. As we're saying, you're not going to have so much time, so I'm going to just ask you 2 questions related to, just to clarify some things that I think it would be helpful when you're presenting, and to describing what we're just mentioning. When you're in your abstract, you mentioned about that the goal was to identify the problems made by the infodemic. So problems is a very generic. So what kind of problems were you looking, right? Because I don't know what your survey was, but making clear what you're looking to get, I think would be helpful. And the second one, I think a little bit going from what Alessandra just mentioned, related to the fake news in a sense. So because when you ask somebody if they heard fake news or if they listen to some for fake news or whatever, so what is the definition of fake news? And I think that's a big thing that you have to put it up front in a sense, because for me and for somebody else, it can mean something else, right? I can believe in something. The other one thinks that that's not a fake news. I can think that's a fake news. So I'm wondering, you probably thought about it, and I think it will be helpful for you when you're presenting this to just clarify this.
Thank you.
And Raquel now, please.
Congratulations, Gabriel. It's very good presentation, very clear. Congratulations. I have also one question for you. Where did you find this questionnaire? Because it's something that you think and your team think about it, or this is something that is validated, or you find it someone else? I think that your methodology must be more clear, because I really don't understand where did you find these questions, or where they are.
Yeah.
And this is very important for us. How do you find this questionnaire?
So this questionnaire in both study is from a big paper. You know, it's a big article, not a resume or an abstract. So when we made this, I take parts. Oh, you know, we develop, me and my orientees, the questionnaire by ourselves. It's from our idea, because in the methodology of the big study, I could write it more clear. So identify common fake news and etc. In the abstract, I could not like express myself clear, you know, but it's only that way. Is it clear? I don't know. It's good.
Thank you. And Fernanda, do you have any comments?
Yeah, I was wondering how the person will describe there is a fake news. They think it's fake. Do they know what is the right information? These people that you interviewed, how do they say this is for sure a fake news or not? Yeah.
So in the opinion pool, we have a question that's listed some fake news, and the people can check if they heard or if they know that someone say to him or her, and by that we can like help people know what is fake news and what is not. But other questions in the questionnaire and ask it if the people believe in a fake news or not being sure. So by that we can understand. I don't know if I made myself clear.
Yes, thank you.
Agora, porque o Sanaflix veio para mudar o jeito como você estuda medicina e mudar para melhor. Primeiro, você pode confiar na gente. Nós somos o maior projeto de educação médica do Brasil. E não é só porque temos estudantes em todos os estados brasileiros e em 10 países no mundo. Nem porque tem estudantes de medicina em mais de 300 faculdades do Brasil usando o Sanaflix. É porque temos uma equipe de mais de 150 pessoas trabalhando para melhorar a qualidade do seu estudo e a maneira como ele chega até você. Nós nascemos da vontade de revolucionar a maneira como você tem acesso à educação médica. A gente acredita que o valor que você dá para a oportunidade de estudar com a gente é o investimento no profissional médico que você vai conseguir ser. Por isso, é importante que você possa acessar a gente de onde estiver. Por exemplo, se você precisa usar o Sanaflix além do desktop, desenvolvemos o nosso aplicativo. Assim você pode otimizar seu tempo aproveitando o nosso material de qualquer lugar e com o mesmo conteúdo. Afinal, quem estuda com a gente sabe bem o que a gente tem de bom. São mais de 700 resumos para você fixar o que aprendeu, 300 fluxogramas para te ajudar a conectar os assuntos, 700 mapas mentais para estudar de forma ativa e, claro, mais de 1.600 videoaulas para assistir quantas vezes quiser. 4,5 de 5 é a nota geral das aulas por nossos estudantes. Elas são dinâmicas e objetivas e estão sempre melhores. Temos uma preocupação especial em aperfeiçoar a metodologia e a didática da nossa equipe de professores padrão Huszcz.
Eu acredito no Sanaflix e eu invisto meu tempo na preparação das aulas porque eu lembro de mim. Quando eu estava no 4º ano, eu tinha a disciplina da reumatologia que era muito difícil, eu quase bombei. Eu fico pensando, se eu tivesse a Aline para me explicar artrite reumatoide, com certeza aquela prova teria sido bem mais fácil.
Quando eu comecei a entrar na área do ensino, eu ficava maravilhado, velho, eu consigo impactar positivamente na vida de diversas pessoas de uma vez só. O número de pessoas que eu estou impactando, velho, que eu estou ensinando e capacitando eles para que eles vão e na extremidade lá possam ajudar as pessoas e melhorar, sabe? E fazer um atendimento adequado, fazer um atendimento bem feito. Isso é sensacional, velho. Isso é muito reconfortante.
Estudar medicina não pode ser caro, tem que ser fácil. Aproveite nossos planos e assine agora. A partir de R$19,50 por mês você pode ter acesso a todo o conteúdo sem restrições. E se você ficou ainda na dúvida e quer fazer um teste, fique à vontade. Experimente o Sanaflix por 7 dias agora.
Can you see it? Yes?
Yes.
So, good afternoon, everyone. My name is Giulia Soares. I am a 4th year graduate at Centro Universitário Saúde ABC. First of all, I would like to thank the ABCMEM organizing committee for organizing this event, and also thank the presence of our examination board. So today I'm presenting a case report about a patient with hip osteomyelitis when being treated a diffuse large B-Cell Lymphoma with chemotherapy, and which led to the diagnosis of a sickle cell trait. Okay. So to begin with, I'm going to talk just a little bit about the non-Hodgkin lymphoma and the sickle cell trait, which are the two main themes that I'm going to address in this presentation. So about the non-Hodgkin lymphoma, is a malignant lymphocytic type of cancer that can develop in any region that contains lymphoid tissue, such as thymus, lymph nodes, among others. And the most initial repercussion is lymph node enlargement in neck, armpits, or groin. According to INCA, Instituto Nacional do Câncer, there are about 10,000 cases each year in Brazil, and they usually affect more men than women. There are many subtypes of non-Hodgkin's lymphoma, but the most common type one is the diffuse large B-cell lymphoma. It's quite a long name, but it corresponds to almost 30% of all the non-Hodgkin lymphomas. This particular type of lymphoma can present in different phenotypes, such as the double hit lymphoma and the double expressor lymphoma. The double expressor lymphoma, which is the one I've outlined here, is defined by the overexpression of two genes, c-Myc and BCL2 genes, which are related to more aggressive types of lymphoma. However, both of these phenotypes that I've just said translate into highly proliferative and drug-resistant lymphomas. Due to this aggressiveness, the treatment of choice is commonly chemotherapy with these 6 drugs that I've outlined here for you, this regimen of these 6 drugs. So a little bit about the sickle cell disease now. Is the most common hemoglobinopathy in Brazil, and it is defined by the replacement of a healthy beta fraction of the hemoglobin with a defective one in the red blood cells. So here on the right side of the screen, I've made a little scheme to roughly explain what it happens. So a normal hemoglobin is encoded by a gene A, whilst hemoglobin C and S, which can later define the sickle cell disease or the sickle cell trait, are the gene C and the gene S. So one important thing to take note is that the sickle cell disease and the sickle cell trait, they have different patterns. On the one hand, the disease has an hemoglobin that has 2 gene S, whilst the trait has one normal gene, which is the gene A, added to one gene S. This particular characteristic of the trait makes it, in most cases, most benign condition than the disease itself. And the physiopathology of the sickling of the red blood cells happen when the red blood cells are exposed to some triggers, such as hypoxia, acidosis, dehydration, or some other triggers. I almost forgot just to explain. Here on the right corner, there are the normal red blood cells, which are those ones that have this round shape. And below, here's the sickled cell form. So to sum up a little bit, all the information that I've talked about, how does the non-Hodgkin lymphoma correlate with the sickle cell disease? The treatment protocol chosen for the non-Hodgkin lymphoma is chemotherapy. The one that had 6 drugs, as I presented earlier. And this treatment protocol, it may release many oxygen oxidative species, which have the potential to trigger sickle cell crisis. And when these red blood cells sickle, they may provoke infarction of the bone and posterior bone necrosis. So let's go to our patient now. It's a male, 55 years old, born in Bahia. And he came to the hematology department complaining about fatigue, weakness, fever, and significant sweating. And he referred a loss of 20 kilos in this period as well. On physical examination, he had a painless cervical lymphedema, painless cervical lymph node enlargement, and then was requested a lymph node biopsy, which revealed a suggestive pattern of diffuse large B-cell non-Hodgkin lymphoma, double expressor status, which was the one that I talked about earlier, and the treatment chosen was chemotherapy. So after his first round of chemotherapy, he had no complications. However, 4 days after beginning the second cycle, the patient returned to the hematology department with new complaints of fever and severe pain near his left hip joint. On physical examination, he had pain and heat and redness on his left hip. An MRI was requested that showed an abscess close to his left hip joint with signs of bone damage, which was suggestive of osteomyelitis. The abscess was then drained by the orthopedics team and were prescribed an intensive opioid analgesia and also an antibiotic therapy. Due to the risks of secondary immunosuppression and worsening of the infectious condition, the chemotherapy had to be temporarily paused. When investigating the osteomyelitis, it seemed a little weird that the patient had this infection on the bone, even without having any getaway to explain this occurrence. One exam that was requested was a hemoglobin electrophoresis that revealed that the patient had a sickle cell trait. 6 weeks after taking his antibiotics, the patient finished his chemotherapeutic cycles, and on an last MRI, he had a left hip with evidence of avascular necrosis, but didn't have any more infection or inflammation. And until today, the patient continues without new events or signs of disease recurrence. So to sum up all the information until now, I wanted to outline some important points to understand the patient's history. The sickle cell trait has a higher prevalence in North and Northeast regions in Brazil. And since the patient was originally from Bahia, and electrophoresis was requested and then confirmed the presence of an abnormal hemoglobin in the red blood cells of the patient, confirming his sickle cell trait. And when being exposed and treated by the chemotherapy, he was into a harsh health condition. He was, never mind. I'm sorry, I'm a little nervous. So again, the chemotherapy was harsh on the patient, and it also one of the medicines that he took was doxorubicin, which is a drug that is known for releasing many oxygen species that are responsible for amplifying oxidative stress, which might have been the cause for the sickling of the red blood cells of the patient. So possibly the sickling of these red blood cells provoked vaso-occlusive repercussions on the patient, and added to the chemotherapy immunosuppression, possibly led to a bone infarction and infection of the bone tissue, even without having the presence of a portal entry for the pathogen. Here I put a quote from an article that is available in the New England Journal of Medicine, and the date is from 1991, that says, femur head osteonecrosis is a widespread pain condition in patients with sickle cell anemia due to occlusive vessel crisis. So I'm just to explain one more time what we understood that happened to the patient. The chemotherapy that the patient was submitted released many oxygen species, not only oxygen species, but it affected the patient in a way that triggered his sickle cell crisis, which then caused vaso-occlusive events, leading to bone necrosis, invasion by pathogens, and posterior osteomyelitis. So to finish my presentation, I just wanted to explain why do I think my case report is important, what is its value. And it is important because it illustrates the importance of studies related to the different clinical presentations of sickle cell disease, as well as the possible need to prior investigation in the presence of the gene S or the gene C of the hemoglobin in situations of high oxidative stress. Because if something had done before, if he had a prior investigation even before beginning his chemotherapy, he probably wouldn't have evolved to a complication of the treatment, which was the osteomyelitis. Here are my references, and thank you very much.
Thank you, Giulia, for your presentation. Alessandra, please.
Hi. So Giulia, congratulations. Really good English and presentation. I like very much. Actually, I could understand better when you explain everything about this correlation, because my first question would be, what's the relevance of this correlation in your study as a case report, since that we know we could have all kinds of infections during the chemo. So I saw there on the internet and the PubMed, so there's no news about this. But then you explained better in your last sentence when you said that it is important to screening patients at the risk to sickle cell disease. And now it's clear. This is good. I don't know if I could call your your case report like a very unique case, but in this context, considering Brazilian patients, that we have a lot of mulatto patients and we have a high prevalence of sickle cell disease, it is important to screen. That's the importance of your study. And now I understand better. So I had a lot of questions before, but now for me it's clear, and I think it is important. It's very relevant. So I think it's this. I think that we are talking about the same thing, right? So I have no questions, actually just comments.
Thank you very much, Alessandra. I think I'm very happy that I could solve some of your questions, and you actually even added up more information to my case report. You could understand what it is, its importance, and I couldn't add anything else. Thank you very much.
Yeah, actually, I have one suggestion. In the title, instead of put leading to sickle cell disease, you should put triggering, right? Or something like that, because it's not because I have the lymphoma or I have the chemo and then leading to, but trigger. That's the right word to put there.
Okay, I will do that. Thank you.
Thank you.
Thank you, Alessandra. Andrea now, please.
Hi, Giulia. Congratulations. It was a very nice presentation, and I agree with Alessandra. It got a little bit more clear. Some things on your abstract, how we were kind of leading to the conclusion. And I think the conclusion was missing, the recommendations that you were just saying right now. It was missing on the abstract. And I think that's a very important aspect. So, and my question to you, I'm not so familiar with this, but would be something that could be thinking about it? Should be a screen be done for everybody who is going to be receiving this? So, and then I'm not sure about it. That's not my area of expertise, but I think that's something you're showing a case that was an important aspect to be done, or to be thinking about it when you're using a medication that's going to be triggering a stress, oxidative stress, but should be done to everybody or for which kind of population. And I think that's a thing to be seen on the literature as you are looking, and as you making the point about this case. And I think it was very nicely done. And I agree with what her saying, when you say, okay, you're talking about the lymphoma, and that they then, because of everything that happened with osteomyelitis, you thought about it looking at sickle cell. But congratulations, I think that it was very nicely done.
Thank you. I actually forgot to say something. I think that we should do this screening possibly that with patients that have epidemiology. For example, the patient was from Bahia, which is I have a data here that says that let me check so that I'm not wrong. In Bahia especially, I found a reference that said that every 17 live births, one has the sickle cell trait. So especially in Bahia, it is it's more prevalent. So probably in these patients, given the epidemiology, there should be a prior screening. But yes, I agree with you. Not every patient should be submitted to an electrophoresis. Thank you very much.
Thank you, Andrea. Estelle? No.
Hi, Giulia. Very nice presentation. Very nice English. I'm proud of you. Very, very good. And I think this is very, very interesting. And I want your opinion about, do you think this is a new guideline? Like everybody who goes to this kind of chemotherapy must be screened for sickle or no? What do you think about it?
Chemotherapy is a treatment that it's used for many patients, right? I don't think it should be a screening for everyone, because probably in most cases it wouldn't reveal anything that could be good to the patient. You know, when you weight the benefits or the problems that the patient may have with this discovery, it may not add anything else to the patient's story. So as I was saying to Dr. Andrea, I don't think it should be a screening for everyone. But what I think is that maybe patients that have a positive history of being from the north and northeast regions of Brazil, it might be of course, when submitted to chemotherapy or any other treatment that has this potential to create immunosuppression, I think it might be useful. It might be good to prevent other complications.
Good, very nice. Congratulations.
Thank you, Estelle. Fernanda?
Hi, it was a very good presentation. I want to ask you, the patient was born with this trait and just had this manifestation when he was 55 years old. We are not sure what was the trigger, but is there any type of genetic analysis saying if the patient has this genotype, use this medication or not? Is there any pharmacogenomics study to show which is the right treatment based on his genome?
Fernanda, that is a very interesting question. But unfortunately, when I began to research the patient's medical records, I went to PubMed, Google Scholar, many references. I couldn't find anything that could relate the pharmacogenetics, but it's a very important question. I can look it up and then add it. If I find something, I can add it up to my case report, so that it's more clear, right? It would make the discussion of the case more relevant, don't you think? It would make it
yes. Would be great if there was a genetic study showing up which is his genotype and what is the best medication to treat. So I think this will be the future.
Yes, sure. I agree with you. Thank you very much. I will do so.
Thank you.